Welcome. In this animated explanation, we will study sulfonamides and co-trimoxazole. These drugs are antimicrobial agents that interfere with bacterial folic acid synthesis. Folic acid is essential for nucleic acid production, so blocking this pathway stops bacterial growth and replication. Classification of sulfonamides is based on use and method of administration. Systemic sulfonamides are absorbed and distributed throughout the body, so they are used mainly for systemic infections. Examples include sulfomethoxazole, sulfadiazine, and sulfosoxazole. Sulfomethoxazole is commonly used with trimethoprim to form co-trimoxazole. Sulfadiazine is used in toxoplasmosis and other systemic infections. Sulfosoxazole can be used for urinary tract infections. Topical sulfonamides are applied directly to the skin or mucous membranes for localized infections. Silver sulfadiazine is applied to burn wounds to prevent bacterial infection and promote healing. Sulfacetamide is commonly used in ophthalmic preparations for conjunctivitis and other eye infections. Sulfonamides may also be described as short-acting or long-acting. Short-acting drugs are rapidly absorbed and excreted and are suitable for acute infections. Long-acting drugs have a prolonged effect because of slower excretion. Sulfadoxine is a long-acting example used with pyrimethamine in malaria prophylaxis and treatment. The basic chemical structure of a sulfonamide contains a benzene ring with a sulfonamide group and an amino group. The side chain, also called the R group, can be modified to create different sulfonamide drugs with different properties. Co-trimoxazole is a fixed combination of sulfamethoxazole and trimethoprim in a 5:1 ratio. Sulfamethoxazole blocks an early step in folate synthesis, while trimethoprim blocks a later step. Together, they produce sequential blockade of the same pathway. Mechanism of action of sulfonamides. Sulfonamides act as competitive inhibitors of the bacterial enzyme dihydropteroate synthase. They mimic para-aminobenzoic acid, also called PABA, which is a normal substrate in folic acid synthesis. When sulfonamides bind to this enzyme, PABA cannot be incorporated into dihydropteroic acid. This decreases formation of tetrahydrofolic acid, which is required for synthesis of purines, thymidine, and some amino acids. The final result is impaired DNA, RNA, and protein synthesis, producing a bacteriostatic effect. Human cells are less affected because humans obtain folic acid from the diet instead of making it de novo. Mechanism of action of trimethoprim and co-trimoxazole. Trimethoprim selectively inhibits bacterial dihydrofolate reductase. This enzyme normally converts dihydrofolic acid into tetrahydrofolic acid. By blocking this reduction step, trimethoprim further depletes tetrahydrofolate and decreases synthesis of DNA and other cellular components. In co-trimoxazole, sulfomethoxazole inhibits dihydropteroate synthase and trimethoprim inhibits dihydrofolate reductase. Because two sequential steps are blocked, the combination creates a synergistic effect and can become bactericidal. Advantages of co-trimoxazole include broad-spectrum activity and reduced resistance development. It is effective against a range of gram-positive and gram-negative bacteria, including pathogens responsible for urinary tract infections, respiratory tract infections, and some gastrointestinal infections. The dual blockade mechanism reduces the chance that bacteria will escape by a single resistance mechanism. The combination also shows selectivity because bacterial enzymes are targeted while human cells do not contain dihydropteroate synthase and do not synthesize folic acid de novo. Adverse effects must be remembered. Common gastrointestinal effects include nausea, vomiting, and diarrhea. Dermatological reactions include rash and photosensitivity. Rare but serious skin reactions include Stevens-Johnson syndrome and toxic epidermal necrolysis. Hematological effects may include agranulocytosis, aplastic anemia, and hemolytic anemia, especially in patients with glucose 6-phosphate dehydrogenase deficiency. In summary, sulfonamides and co-trimoxazole inhibit folate synthesis, impair nucleic acid production, and stop bacterial growth. Co-trimoxazole is powerful because it blocks two sequential enzymes in the same pathway.